Good morning. Amanda Hansen here at the Action News 5 digital desk, and we want to talk about diabetes. It's American Diabetes Month, the month of November, and it's something that is so common here in the South, and that's why it's so important to make sure that you get education about how to prevent this from happening, from you getting diabetes. And joining us now to talk more about it is Dr. Amit Prasad, the Chief Medical Officer for Methodist South Hospital. Doctor, good morning. How you doing?
Good morning, folks. I'm doing well. Thank you.
Well, we're so glad to have you on this morning to talk about this topic. This is something that affects so many people. I know my dad had type 2 diabetes, and I know at one point he was told he was pre-diabetic. There were some things he could do to try to help prevent it from turning into diabetes. And so I feel like it's so important to talk about this with November being American Diabetes Month. So I guess that's kind of where I think we should start is, what can people do to prevent from getting diabetes?
Yes, I think it's a very important topic, and it's not just today or this month, it's every day of the year. Unfortunately, we have a lot of diabetes in this country. So we are looking at approximately 37, 38 million people that have diabetes. What is even more concerning than that number is the fact that several people, up to 1 in 5, do not even know that they may have diabetes. So really, I think awareness is key. And also, it's very important that everybody have a primary care doctor that they can go to and visit and have blood tests and screenings and so forth. Unfortunately, a lot of times, now sometimes diabetics may have some symptoms. They may have increased urination, increased thirst, change in vision. But unfortunately, many people with diabetes do not have any symptoms at all. So the only way to tell if you have diabetes is going to be getting tested for it, especially if you're at high risk for type 2 diabetes.
Wow, that's interesting to me, to just talk about no symptoms at all, anything like that. I mean, if you go get a physical once a year, is this something that you would probably come back and find out more information about, correct, doing blood work and things like that?
That's right, absolutely. So a physical, getting blood tests, checking your cholesterol, checking your A1C, checking your glucose numbers on blood tests, those are really important.
Absolutely, and I think it's one of those things that during the pandemic, a lot of people put off things like those yearly physicals and things like that. So it's so important to make sure that you're getting those done. Let's just talk about why prevention is so important.
So the problem with diabetes really is that high sugars are toxic to blood vessels. And so they'll impact the blood vessels in your heart, in your kidneys, in your brain. That is why people get complications. They get heart attacks and strokes and kidney damage. So again, the important thing would be that if you do have diabetes, you take some steps to make sure that you control it. And it is a disease, a condition that can be not only prevented, but if you do get it, it can be controlled. A few very simple things that you can do. You mentioned pre-diabetes. That again is a very important condition. That is an early warning that you may be at very high risk of developing type 2 diabetes. So if you do have either pre-diabetes or even if you have diabetes, a few things that you can do starting today. One is that get physically active. Sedentary people are at much higher risk for type 2 diabetes and also for progression of pre-diabetes. So being physically active, I think, is a very important something that you can do starting right away. Then watching your diet. I think it's not just important that you be physically active, but you also watch what you're eating every single day. So avoiding, high calorie foods. What I always tell people is that enjoy food, not the calories. So slow down while eating, consume more whole grains, cut down on your red meats, a few simple things you can do starting right away that'll help you with your sugar trends and your weight trends. So these, I think, would be the most critical things to start today. And then, of course, like I said, stay in touch with your doctor. There are several medications available now that'll help you control type 2 diabetes and also control other risk factors that you may have, like high blood pressure and high cholesterol.
It is great to know that there are things out there. You're mentioning medications, lifestyle changes, and things like that. I know for my dad specifically, he had one of those little sensors that he could put his phone up to where he could kind of monitor his blood sugar levels. His doctor could have a better gauge of what he was dealing with to make sure that it is staying under control because, like you said, that is so important. And you were talking about things like stroke, heart attack, kidney issues. Let's just talk a little bit more about some of the risk factors when it comes to diabetes.
So unfortunately, many people with type 2 diabetes also have other medical problems. So they may have high blood pressure and high cholesterol, and all these become cumulative. So if you have type 2 diabetes and you also have high blood pressure, high cholesterol, your risk of getting a heart attack or a stroke are even higher than if you just had high sugars. So again, these are the risk factors that you need to not only be aware of, but also treat and manage. Unfortunately, diabetics are at very high risk of kidney failure, leading on to the need for hemodialysis. They also are at high risk for needing amputations in case they have injuries in their feet and their sugars are uncontrolled. So, and visual blindness. I mean, the biggest cause for adult blindness in this country is type 2 diabetes, which has not been controlled. So you have damage that develops in blood vessels in the back of the eye. So these are all conditions which, by getting preventive checkups and by controlling your sugars, you can avoid.
And you were talking about some people maybe don't have any symptoms, but what are maybe some of those warning signs or symptoms that people can look out for that they may be experiencing and need to maybe go get checked out?
Absolutely. So the most common thing, like I said, is no symptoms. But yes, if you are experiencing increased thirst, increased urination, changes in your vision, those could be early warning signs that you may have diabetes. But again, I stress the importance of recognizing the fact that a lot of people may have either no symptoms or very mild symptoms. So the only way to tell for sure, especially if you're high risk, would be getting yourself tested and following up with your regular doctor.
Well, this has been very informative, a lot of good information. Anything else you want to make sure we hit on before we let you go?
Well, take ownership. This is a condition which can be managed, can be controlled by making a few changes in your lifestyle and a few changes in your diet and being in close touch with your regular doctor. You can control this condition.
Well, of course, we appreciate you taking time, Doctor, and sharing more of this information, and you have a great morning, all right?
Thank you.